All right. Well, hello, everybody. My name is Trisha Body, and I work at the Southwest Florida Community Foundation. I am the head of social impact and connectivity, and today we are talking about COVID-19 and employee and emotional health. We are talking about this on our Thrivability program, which brings together national and local gurus to talk about things all nonprofit, as well as things for resilience through pandemics or whatever the life challenges are facing us. So today we have a really good conversation. We know that the pandemic is not just about the actual COVID virus itself. There are things that are going on outside of that, and one of which is behavioral health and mental health. And, a recent study found that more than half of employees are afraid to discuss their feelings with their boss. So today we have Dr. Nick Dewan from Florida Blue, who's here to help us understand what we're all feeling and what we can do for ourselves and our employees to kind of address these issues. So just as a little bit of how amazing is Dr. Nick Dewan? He's the current vice president of behavioral health at Florida Blue. He's an accomplished physician and an executive with more than 25 years experience. And I've heard he's considered a pioneer and an innovator in behavioral health. So I'm really excited about that as well. And he previously served as the chief medical officer for behavioral health for a major health system spanning 5 Tampa Bay counties. So without any further ado, less about me, but Nick, I just want to thank you for being here. And I'd love to learn a little bit more as we do this Q&A about what are the biggest impacts in the behavioral mental health for COVID-19?
Well, thanks for having me on. It's a real pleasure to be with you today. I mean, here we are. We are at a once-in-a-century event. And what's different about this once-in-a-century event is that we have an invisible, unpredictable, and constant threat. And that's never happened before. And an invisible, constant unpredictability. And what that does to people, it raises body adrenaline, brain adrenaline, it exhausts people. We've had a dismantling of our social connections. So the impact is anxiety, depression, stress, irritability, impulsivity, using more alcohol and drugs. So I have not seen anything in the last century as much to almost everyone in society than what this has done. And the data speaks for itself.
Yeah, it's a very scary situation on many different levels, but the layers of this behavioral and mental health is very concerning, not just employees, employers, but as parents, as brothers, sisters, friends, you really get concerned. So, my question for you is, why are we having these reactions and what does it mean for our overall health?
Well, we are wired to survive and we are wired to thrive. Okay, we're wired to those two things. So whenever a stress comes along, our adrenaline goes up and our survival mechanisms go up. But here's a situation when the usual and customary coping capabilities don't exist. We can't go hang out with somebody. It's really hard to do that. And so our normal coping capabilities aren't there. And because people don't like to share in their distress, that's even worse. So you end up being a silent sufferer. So I think for employers, it's one of the things leaders in employers or in organizations can do is, hey, I know this is a distressful time. I know this is tough. I know this is creating pain and suffering. If you need help, let's get you some help. Everybody's going through this. And, I have my physical health colleagues saying, hey, wear a mask, wash your hands, keep your distance. When you have a threat here and you have a coping here, the only way to reduce that threat is to say, let's wear the mask, let's wash our hands, let's do our social distancing. And then you can start coping with the connectivity issue. But if you don't change the level of the threat level, it's hard to change this. So for me, making sure you do the physical health thing right is as important as doing the mental health thing.
Yeah, I couldn't agree more. And the connectivity aspect, I think, is something that we all have kind of, struggled through to figure out how we can be better at that in this virtual world. But so what are some of the things, you talked about coping, but, what are ways in which we can help with a cope? and kind of can't
Oh.
this emotional health?
Well, let's talk about at a leadership level. I already said let's make sure we validate, we communicate with our employees. Okay. The other thing is here, all our employees are in what I would call an unpredictable environment, and so for a workforce, let's try to be predictable in certain ways. Like some companies that says, hey, if you can do virtual, we're going to do that for 90 days. It's not switching every 5 days. Let's switch what we do. Let's do something for the long term. So that's number one. You and I are talking virtually. Well, we should really have, part of being at work is having that sort of water fountain conversations or the lunch table conversations. I think small or large organizations should be encouraging what I would call Zoom lunches, if possible, Skype lunches, FaceTime lunches, whatever it takes to make people feel they're still connected to those that they work with, and make the suggestions that you may have lost connections with your friends, your neighbors, your uncle, your aunt, your buddy from high school, whoever. Now is the perfect time to have the visual connection with them, because I really do think people are missing out on that, and that's a real important sort of supportive side. And then finally, if none of that works, there's resources. And when you want me to talk about the kinds of resources we have in the community, I'm happy to do that.
Yeah, no, I think that's great. I think the one key that I need to work on is probably scheduling more lunch conversations that are not just work related with current employees. So I think those are really good tips for sure. I think you kind of addressed this, but one of my questions is like, what are the tangible ways to support your employees right now, and how can you make them feel more comfortable and empowered during this time?
I think if they want, you can say flexible work schedules. Let's say you have to you have errands. Maybe you have an elderly parent that you go see, social distance at the nursing home. Let's say that's an issue, or you need to go run an errand because something is going on. I think work flexibility, and also telling people it's okay to be what I would call be in a relaxed mode, recovery mode. Let's face it, when there's this constant threat, everybody's adrenaline is up. Everybody's exhausted. So saying it's okay to rest. A lot of times in a virtual working environment, people want to do emails, phones, texts, video conferencing all at the same time. And that's actually the worst thing that you can do, because our minds are already preoccupied with what I would call, NASCAR speed and like 6 different cars going at the same time. And I think the message is, whether you like to look at the water, whether you like to look at trees, whether you like to do yoga, meditation, whatever the case may be that allows you to slow down your mind. It might be music listening. This is a time when your adrenaline is through the roof. You've got to know how to tune that thing down, because if you don't tune that thing down, your blood pressure is going to go up. You're going to feel more anxious. You're going to feel more irritable. And so anything to dampen what I would call that threat level, every employee should be doing. Every employer should be encouraging what I would call those soft sort of turn the volume down activities. And, there's a tendency during all of this. People tend to eat more. They tend to exercise less. They tend not to sleep as well as they should. So I think the other thing is you have to be very intentional about really taking care of yourself. You have to really say, hey, this is a time when taking care of your mental health and physical health is important. And I want to go back to this reducing the threat. Here we are, when people are driving more, we could be on a highway going, maybe the speed limit, maybe a little bit more, but we'd stay in our own lane. Wearing a mask. That's called keeping our social distance. We can do it on the roads. Now that we're off the roads for most of the time, we can do that. So we know how to be careful together. And so to me, if you're connected to somebody and you're being careful together, that's actually a bonding experience, and that helps with the connectivity. So those are some tangible things I think that can be done.
Yeah, those are excellent tips, to be honest with you. I can think of several of myself that I need to work on, including the sleeping. But and everybody's going through it. So it's important to note that when this is one of the reasons why we're having this conversation, because it's very helpful, especially to hear it from someone like yourself. Just how important those little tidbits can be to your overall health, for that matter.
You have to do it.
The one thing that we have found is that a lot of the nonprofits have been servicing, a certain people that they serve for many years. But during this pandemic, many of them have had to deviate. They've had to shift their work. Some of them have now become those essential workers. They probably were before. So this is something that they weren't used to, right? This has put them in harm's way, or this has put them in more a place where there could be potentially, some involvement with being around people with COVID, or whether that be with children. So my question to you is, what advice do you have to help for essential workers, especially those who didn't know that this was going to be the work that they were doing? Because I think that's really important.
I think because this is about physical safety, maybe people weren't, and I'll give the car example. If you haven't driven a car, you got to make sure you put your seatbelt on. You got to make sure you put the signal. So what you have to have, what's I would call an internal safety checklist. And as long as you follow that, you're what I would call a little fear will still be there, because obviously it's a novel situation, it's a new situation. But we know enough how to keep yourself safe that if you do that internal checklist, you're going to be safe. You can assure yourself, all right, did I wash my hands? Yep, I did that. Did I cover my face? Yep, I did that. When I got done with work, when I came home, did I make sure that I washed my hands, changed my clothes, took care of everything? So even if there was a 0.0001% chance, I've eliminated that to zero. Now, the reason why this is important, we are wired, like I said before, we're wired to be survivors, okay? So that's why we are in tune with what I would call the potential threat. But in this situation, it's fairly easy to convince yourself and to tell yourself, am I doing these 4 things? And if you're doing those 4 things, you feel a lot safer. And that's the key. Have that internal checklist in mind. And then if you know somebody that's like this, if you're a leader and you've got employees that have gone from what I would call not in harm's way to in harm's way, they thank you every single day. They need gratitude. They need compassion. They need positive emotions coming their way, because let's face it, they're feeling that stress and anxiety. So as a leader, positivity, compassion, gratitude is critical for what I would call the essential workforce.
Yeah, that's really great. Again, more good advice. I guess what I was told earlier about who you are, I think is resonating a lot, with your innovative ways and thoughtfulness about how you're presenting this. But I think it's really important. I know that many insurance companies have been really stepping up when it comes to addressing this. And I know many of the people who are going to be listening to this may not have Florida Blue, but maybe they can call their insurance companies or call someone to find out if they have this availability. But what are the things that you guys are doing at Florida Blue that is trying to combat and address this issue of mental health during this pandemic?
Well, first of all, we have a toll-free number. Let me get that for you. 833-848-1762. That's 833-848-1762. Now, we have centers where we have team members and help people navigate to the right behavioral health support. So, we've got the retail centers, call them up, talk to them. We've got people waiting, and we're here to help. They know how important this is. And we also have what's called these community specialists, and that's 877-352-5832. And that's Monday through Friday, 9 to 7, and Saturday, 9 to 4. So I'll say that number, 877-352-5832. So we've tried to get what I would call the behavioral health resources. We've tried to get the local resources, and we've have real people trying to help navigate how you can get help. But the bottom line message here is we're going to all be safe together, but we also have to think about being careful together. Just like when we drive on the highway, we're careful together. That's why we can drive on a highway. And in this sort of invisible, constant, unpredictable situation, if we're careful together, we're all going to have less stress in our lives. So I think that is the most important message, is we can all help each other reduce the stress in our lives. And once we reduce the stress in our lives, we can feel better and do the things we want to do.
Yeah, I mean, that's really helpful. Yeah. I think, one of the things that we've really looked at is, and I think I've said this to you, is that, we're a community foundation, right? So we're providing the information, and it's great that you guys at Florida Blue, and I'm assuming other insurance companies too as well, have really kind of stepped up, just like our nonprofit community has stepped up to service those who are addressing mental health. So I want to just commend you and say thank you for your time, and thank you for the opportunity. Again, we're not in that lane, but we want to bring the experts and the resources so that they can go out and find that information and have it readily available. So your time with us is been, we really appreciate it. It's important, the message that you're giving to our community, because this aloneness is something we're all very uniquely aware of it. But addressing it and coming together in that community sense that you said really is a sense of hope. And I just appreciate that. But before I cut us off for the rest of our video, is there anything else you wanted to say? You have the Southwest Florida community listening. Is there any additional information you hadn't said that you'd like to add?
I think your organization supports what I would call the courageous leaders in our community. And this is a time for those courageous leaders to step up and say, I feel your distress. I understand your distress. We're doing things to help reduce the distress, and we're here to help. And I think this is really where leaders can innovate and strategize. I mean, this is what leadership is all about. So I thank you and your organizations for being part of the solution. It's been great to be with you.
I'll go off on the note when you say courageous leaders, because we are very grateful for the amount of them that are in our community stepping up right now. And I hope they're all listening and know that we're all in this together. So for sure, to our courageous leaders, thank you for listening in. And Doctor, thank you so much for your time. We do appreciate you in Florida Blue.